Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Jennifer McNeil, Communications Director of the Northeast Ohio branch of the American Heart Association. Good morning and welcome to the show, Jennifer.
Good morning. Thank you so much for having me.
We'd like to remind your listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. And we have been on the air for close to 13 years, so there is a lot of material out there. So we've had some very special guests. So the American Heart Association was founded by cardiologists in 1924 and has become the nation's oldest and largest voluntary organization dedicated to fighting heart disease and stroke. Heart disease is the #1 killer worldwide, and stroke ranks second globally. Even when those conditions don't result in death, they cause disability and diminish quality of life. The AHA wants to see a world free of cardiovascular disease and stroke. February is Heart Month, and we all have the power to take action to protect ourselves against heart disease. So again, Jennifer, welcome to the show.
Thank you so much.
Tell our listeners a little bit about yourself and your role with the American Heart Association.
Sure. So I am the Communications Director of Northeast Ohio, and we have a pretty large footprint. So it's the Akron-Canton area, but we also extend all the way into Northeast Ohio. So Trumbull County, Mahoney County, Columbiana, and a little bit into Pennsylvania. And my role with the American Heart Association is to make sure we get the word out about the things that are important. And number one is getting cardiovascular disease under control. And so in my role, I reach out to press and I reach out to people like you who have this wonderful show so that we can chat about the things that people should be doing in order to protect their hearts.
So what is the significance of Heart Month this year?
So this year, the theme, as it was last year, is all about CPR, because as you said earlier, cardiovascular disease is the #1 killer of men and women. But let me give you a statistic that'll put that into perspective. It kills more people worldwide than all cancers combined, right? When you think of it in those terms, how many people out there are suffering with cardiovascular disease, it's really mind-boggling. So this year for American Heart Month, the American Heart Association is asking people everywhere to join us in joining the nation of lifesavers, because when we all come together, we can motivate and educate and support each other and help save lives. So what is the nation of lifesavers? It's a goal that we have to have one person in every home across America trained in how to perform and understand how to perform hands-only CPR. In the event of a cardiac emergency, they'll be prepared.
Wow, interesting.
And it's important because 70% of cardiac emergencies, cardiac arrest, will happen outside of a hospital setting, right? And that means it could happen in your home. And if it happens in your home and you're called upon to perform hands-only CPR, it's most likely going to be someone that you know, most likely someone that you love. And so being prepared in that moment is vastly important.
Thank you for that. It is, I read an article last night about someone who was having a heart-related event at their job and they felt they couldn't leave. And, it made me think a lot about some different things, especially in my own experience where, everything with heart and everything about your heart is about the time. So you just can't wait. You have to act now. And if you need help, you got to ask somebody for help, or
right.
If you can offer that help, like you said, as simple as chest compressions, it's important.
Well, I'm glad you said that, because time is of the essence with any cardiac event. Whether you're having a heart attack or whether you're in cardiac arrest, time is of the essence, and you need to get help immediately, as soon as possible. With cardiac arrest, that means hands-only CPR compressions need to start right away. Every second you wait, it's more time for cells to die.
And maybe just to clarify your point there, you're talking about hands only compressions because someone's collapsed, basically. Okay. So they're not responsive and they're probably not breathing. So if you check and see they're not breathing, you put your hand over their mouth and you don't feel any breath or you don't see their chest rising, then you can start those compressions. So
That's correct. And that would be in the event of a cardiac arrest. But so let's talk about heart attack, because people confuse heart attack with cardiac arrest all the time. So let's start with heart attack and the symptoms of that, right? Generally speaking, you're going to have pain or discomfort in the chest. That's the one we all know, right? Everyone knows that if you have a sharp pain, a heavy feeling in your chest, could possibly be a heart attack. Lightheadedness, nausea is a symptom. Vomiting is a symptom. Jaw, neck, or back pain can be symptoms of a heart attack. Discomfort in the arm and the shoulder, and shortness of breath. Those are all symptoms of heart attack. You need to call 911. It's not even, don't ask someone to take you to the hospital. Calling 911 is generally faster because the paramedics get to you and treatment starts immediately. If you spend time trying to get there in the car, it might be a 15-minute car ride to get there. And that's time where those symptoms are going to increase. And there's a possibility that you could pass out or have other issues along with it. So those are the general symptoms of heart attack. But women experience heart attack a little differently. So men and women both typically experience chest pain. That's the most common heart attack symptom for both. But women experience other symptoms more frequently than men, and they're typically less associated with heart attack. And women will see shortness of breath, nausea, vomiting, back or jaw pain. In fact, jaw pain is a very common one that women experience and men not as much. Those are symptoms that should not be ignored. None of those symptoms should be ignored. Chest pain is the definite indication of a serious problem, right? But if you're feeling any of those other symptoms, even if they're mild, because they're not normal, it's always better to be safe and get to the hospital, call 911, get an ambulance coming to you so that you can get the emergency care and standard practice of care as soon as possible.
So of all the symptoms that you just mentioned, maybe just to sum it up, what is a couple main symptoms that you just simply should not ignore and you should seek medical treatment immediately?
Chest pain, shortness of breath, I would say two highest, right? Because those are very abnormal symptoms. But any of the other symptoms as well, go to the hospital. They want you to come to the hospital. Don't look at it as, oh no, maybe it's not, maybe I'm having indigestion, or maybe I have a tooth infection and that's why my jaw hurts. If your jaw didn't hurt yesterday and just started hurting today, that is not a common, nor is that a normal symptom. So you need to get immediate care for that. You need to go to the hospital, any of those symptoms. But like you said, the top two, I would put chest pain and shortness of breath, because those are definitely not normal symptoms. And if you're experiencing that, you are in trouble and you need to seek medical attention.
Okay. Is there anything else you want to comment on between differences in cardiac arrest and heart attack, or we cover everything that you wanted to cover?
Well, let's talk about that, because there are some major differences. We've talked a lot about what the heart attack symptoms are. And heart attack is a circulatory problem, right? So you have a blockage and the blood isn't getting to your heart and it's not circulating through your body. So you're not getting oxygen-rich blood in the places where it needs to go. That's a problem, right? But it's possible that those symptoms are happening over days, even weeks, or you have a sudden onset. You could be in heart attack mode for a week or two, and you have a blockage and you're feeling a little bit of the symptoms, but they're not strong. Cardiac arrest is a sudden collapse. It happens instantaneously. That person is unresponsive. That person is not breathing. That person does not have a pulse. If someone has a heart attack, medical intervention may not need to happen immediately. So you may not have to give CPR with a heart attack. Now, a heart attack is a leading cause of cardiac arrest. So if that heart attack progresses into someone suddenly collapsing, they are not breathing, they have no pulse. And what I mean by not breathing is they might make a sound, like a gurgling sound. That is not normal breathing. If that happens, here's what you need to do. Number one, grab your phone and call 911. If there's no one with you that can help you, you put it on speakerphone, you put the phone down next to the person who has collapsed. You need to start hands-only compressions right away. You put your hands in the center of the chest, you press hard and fast, 2 to 2.5 inches in, 100 to 120 compressions per minute. And you need to keep doing that until paramedics arrive, they can assess, and they can put the AED on to shock that person back to life. Those are indisputable facts. Those are things that need to happen immediately with someone who has suffered a sudden cardiac arrest. That person will not bounce back. They will not suddenly wake up. Just like Damar Hamlin on that football field, we all saw it, right? You watched it happen. The only way that he came out of it was intervention. They immediately started CPR. They put the AED on. They shocked him back. That was the only way for that to happen.
Wow.
So those are the big differences between heart attack and cardiac arrest.
Okay. So Jennifer, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy, friends. Just a reminder to stop by the pharmacy and talk to a pharmacist about your Health Matters membership savings program. We want to help you stay well and save money.
Okay, we've talked a lot about heart attack and cardiac arrest this morning. I think we covered that subject, and we can go on to your next question, Dad.
Oh, okay, sorry. How can a loved one or bystander be alerted that someone could be having cardiac arrest?
So, as we talked about a little bit earlier, it is a very sudden, abrupt collapse. So, I mean, that's not a normal thing to happen, right? So if you're with someone and they suddenly drop to the ground for no reason, no indication that it's about to happen, and they're not breathing, they have no pulse. And, like we said earlier, not breathing, they could be making a noise, like a gurgling noise, but that's not breathing, right? So we want to make sure we check that. Are they breathing? Do they have a pulse? If those things are not happening, that's an indication that you need to start hands-only CPR. It's cardiopulmonary resuscitation, and it's a way to circulate blood to the brain and other vital organs when the heart stops beating. So that's what cardiac arrest is. The heart has suddenly stopped. It's an electrical problem. Something has caused it to abruptly stop. And now you need to take action. So you call 911. If you're alone, you put the phone down, you put it on speakerphone, and you start compressions, hard and fast in the center of the chest, 100 to 120 beats per minute. You can also become trained if you'd like, and then you would do the rescue breaths. So if you get that training, you can go to our website to find out how to do that, and then you add in the rescue breaths. But what we know, what science has proven, is that compressions are most important because you already have some oxygen in your blood, right? From the last couple of breaths that you took before you collapsed. Compressions are going to circulate that oxygen-rich blood throughout the body. So compressions are the most important thing that you can do. And just about anyone can learn and perform hands-only CPR. We know that children as young as 9 years old are able to successfully perform hands-only CPR. I have 3 children. They are 14, 13, and 10. All 3 of them are trained in hands-only CPR, and we're able to do it successfully on an Annie doll, and they have a click where you know you're pushing in hard enough and fast enough, and they were able to successfully do that. So that shows you just about anybody is capable of learning how to do this. And the American Heart Association is the leader in resuscitation science, education, and guideline. So if you go to our website, this is step number 1. You can watch a 90-second video that shows you in detail how to perform hands-only CPR, and you can learn it in 90 seconds. You can sit down with your family, with your friends, with your children, watch it together, watch it multiple times so that it really sticks in there. And all of you will understand how to perform hands-only CPR. I get this question a lot. What if I'm not doing it right? I would say this, that person who has suffered cardiac arrest is not coming back without your help. So even if you're not doing it exactly correct and pushing in all the way as far as you need to, you're probably doing a little bit of work there that's helping their heart to circulate that blood, right? And then I get this question, well, what happens if I hurt that person? You're covered under the Good Samaritan law. If you're trying to help someone who has collapsed, who is not breathing, who has no chance of survival, and you're trying to help them and you crack a rib, because it's possible, you're covered under the Good Samaritan law as a person who was trying to save a life, and in trying to save that life, you caused harm, you're covered under that law. So they can't turn around and try and say, oh, you broke my rib while saving my life. You're covered under that law.
So what's the site we go to see this 90-second?
We make it easy for you, hearth.org. And if you want more specific, hearth.org/CPR. And then you can read some information. There's some material there. And you can click on that video and watch a 90-second hands-only CPR demonstration. And it's very simple, very easy to understand. My children watched it and understood it. And then it's it's the first step in learning how to perform hands-only CPR.
Interesting. Cardiopulmonary resuscitation. That is CPR. Okay.
It is. It is.
You know, there's so many people that don't know about this and don't know how to do it, and that's I had not heard that before, that she had a 90-second commercial out there. We're gonna push that. So
yeah, it's a really easy, free way to just take a look and understand how to perform hands-only CPR. And then we have people who go to that video, and after they watch it, they decide, you know what? I want to take the training course and get certified. And that is a much more in-depth training course that includes the rescue breaths, which you can do. But like I said earlier, what we know now, what science has proven, is that the compressions are the most vital part when someone collapses. And did you know also, here's a good point, that women are less likely to receive bystander hands-only CPR if they collapse in a public space. They're less likely to receive it than men.
Wow, interesting.
Do you know why?
Yeah, right.
No, why?
The obvious reason is because rescuers are often fear accusations of inappropriate touching, or they fear injury if they're bigger, stronger, and it's a smaller person. They're worried that they're going to injure them in the process of trying to save their life. But I can tell you, I speak for myself, and I think I speak for women everywhere. If we collapse, you're our only hope. If it happens in the mall and I'm by myself, and Brad, you're walking by, you're my only hope. Please help me. Please do it. If you break my rib, I'll shake your hand after the fact, because I can survive a broken rib. But without intervention, the chances of surviving a cardiac arrest are slim to none.
Interesting.
So why is CPR education especially important among young women?
Well, because young women don't realize that they are susceptible to cardiovascular disease. Women as young as 20 years old are susceptible to cardiovascular disease. And we'll get into this in depth, but people don't know that they have it. People aren't getting regular checkups. People aren't paying attention to those important numbers, those health indicators that can tell you what your risks are. And women as young as 20 years old, we're finding, exhibit some of the risk factors, and they don't know it. And again, important for women to know hands-only CPR for each other, because like I just said, women are less likely to receive it. So we need to train ourselves too in how to perform it. So if we see another woman collapse, we know what to do as well, just in case there's a man that isn't quite feeling comfortable performing CPR. We need to be able to do it as well. So twofold, really. Understanding that women, cardiovascular disease is the #1 killer of women also. And I know most people look at it as a man's disease, right? If you think of heart attack, don't you normally think of a man? Not true. Women it's the women's #1 cause of death is cardiovascular disease. Heart attack and stroke is #2. So we need to change the way we think about cardiovascular disease and that it's not a man's disease. It is a universal disease.
Interesting,
Mhm.
to say the least. Huh.
All right, so we've got just a couple minutes before the news break. Can you talk about what it means to know your numbers in this point in time?
Sure. You can't manage what you don't measure. So you need to know what your risks for cardiovascular disease are. And that starts with knowing your blood pressure, cholesterol, blood sugar, and BMI or body mass index. Those four things are big indicators that you could be at risk for cardiovascular disease. So you need to find out what those numbers are, see where you are on those charts, and that'll tell you whether you're at risk for cardiovascular disease or not.
Okay.
And how do we do that? Go to your doctor. Go to your doctor. You should have yearly physicals, even if you're in great shape, if you run 3 days a week, if you work out, if you eat well. Family history plays a big role in cardiovascular disease, and there's no stopping that train. That's why even if you feel like you're in really good shape, you should still get a yearly physical. Most insurance covers it, and they'll do that blood work for you. Talk to your physician about the results of that blood work and find out where you are. How much of a risk do I have for cardiovascular disease? Because you can't fix what you don't know and what you don't understand.
Incredible. Wow. So how often should we be tested for these metrics, and where can we have the test administered in a reasonable length of time?
The most important thing for that initial visit is get to your doctor, right?
Okay.
So you want to make sure your doctor has all the information. He knows what your blood pressure is, whether your cholesterol is elevated, what your blood sugar is, am I at risk for diabetes, and is my body mass index too high? Your doctor will determine how often you need to be tested, but I would say if you've taken the test and they all come back normal, you should do it again the following year. If you find any problems, your physician will make sure he's monitoring that, and he will schedule appointments for you, and you need to go to those appointments. If you don't have any issues, you need to make an appointment for the following year and have all of those numbers rechecked. Because again, anything can change in a 1-year period. You could have normal cholesterol, and within a year, it could be slightly elevated. And now that's an indication we need to start watching your cholesterol. Blood pressure is a big one too.
Okay. Bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning we are talking with Jennifer McNeil with the American Heart Association.
Hello.
So, what did we miss on that last subject?
So we came out kind of talking about testing and metrics, and some things maybe we can talk about is, ways to get some of those metrics under control. So blood pressure, cholesterol, blood sugar, and BMI, which is body mass index. Those are the four big indicators that the American Heart Association kind of watches as indicators of your risk for cardiovascular disease. So first, let's say you have high blood pressure. What do you do if you have high blood pressure? Well, the first thing you need to do is go to your doctor and make sure you're being monitored. And he may send you home with a self-monitoring system where you can take your blood pressure multiple times a day and chart it and track it so you know where you are. Your doctor might suggest medication for you, but there are some ways that you can help yourself as well. And most people already know them, right? So eat smart, eat a healthy diet, fruits, vegetables, whole grains, beans, nut-based plant proteins, lean animal proteins like fish and seafood, limit the sugary foods and drinks, limit the red or processed meats, salty foods, limit those, and refined carbohydrates. Now, you can eat those things because it's impossible to cut it all out, but you want the bulk of your diet to come from the better foods. The second thing you need to do is move more. You need to exercise. Physical activity helps control blood pressure, weight, and stress levels, which all can lead to cardiovascular disease. So moving more will help you manage your weight. If you're overweight, even a slight loss, 10 pounds, can reduce your high blood pressure. And then no nicotine. We need to stop this vaping and smoking epidemic. If you smoke, vape, use tobacco, the nicotine can cause a temporary increase in your blood pressure. And if you already have high blood pressure for other reasons, now it's even higher because you've ingested nicotine into your system. And then lastly, you need to find a way to sleep, right? We say 7 to 9, feeling fine. As an adult, you should sleep between 7 and 9 hours for optimal health. While you're sleeping, your cells are regenerating, your body is resting, your heart rate drops, and allowing your heart to rest too. If you sleep less than 7 hours, poor quality of sleep is also associated with having high blood pressure. So those are all things that you can do on your own without intervention that can help lower your blood pressure. Now, you need to see your doctor, as we spoke of earlier. Cholesterol is another one where a lot of those same things are going to help lower your cholesterol. The heart healthy diet, the exercise, losing weight. If you lose 10% of your body weight, you can dramatically reduce your risk for high cholesterol. And you can, if you already have high cholesterol, you can reduce the number as well. Stop smoking. Smoking is another way. It also contributes to high cholesterol. But here's one with cholesterol that you have no control over. All those recommendations are not going to work if you have a family history of high cholesterol. If you have it on both sides of your family, you could be a runner, lift weights, you could exercise every day, and you may still have high cholesterol because of family history. And that's when medication and your doctor might be indicated, because all the things you're doing right already, and you still have high cholesterol. Glucose numbers, very much the same. Lifestyle changes, lose weight, eat healthy, type 2 diabetes, and control type 1 diabetes. So you can minimize other risk factors with like high blood pressure and high cholesterol by keeping your blood sugar low. So do you see how all of these things kind of revolve around each other? If you take all of these steps to say reduce cholesterol, you're going to be taking all the right steps to reduce your blood glucose level and your BMI, because losing weight is the number one way to drop your BMI. And how do I drop my BMI? Eat healthy, exercise, do all the things we just spoke of, and stop vaping and stop smoking, because vaping and smoking can lead to overeating. And do you see how it all is just one big circle? It's very cyclical. Doing one thing can help reduce all the other things.
So, at the beginning of the show, you mentioned how important it is for people to get their annual physical and checkup, to be aware of their current baseline, if you will. One of the things that we do offer at the Medicine Center pharmacies are screenings, and we can offer lipid panels and cholesterol screenings and also glucose screenings. So if for some reason you don't have a primary care physician now, or you just want to, make an appointment and pop in and see what your numbers are, we have a very affordable way of doing it. It doesn't take much time and you get results right on the spot. So don't be afraid to take advantage of that service. It's something that we've offered for quite some time, and you could just go to our website and pick which location is most convenient for you and schedule a time, and one of our pharmacists will take care of you. So I wanted to throw that out there, because knowing your numbers is important. You don't know what you don't know, and you're not necessarily going to know you have high cholesterol, and you're not necessarily going to know you have high blood sugar, just like you said.
Right. You could be very healthy and still have high cholesterol because you've got that family history working against you. And if you want to start to be healthy, and we think of terms of which numbers are most important, blood pressure is one that you probably need to monitor closely, because blood pressure, if out of control, can lead to stroke. But all of the numbers, with simple lifestyle changing, diet, exercise, healthy eating, you can dramatically change your life. So we call it Life's Essential 8. Right? The American Heart Association has identified 8 areas that can help you live a healthier, longer life and to avoid cardiovascular disease. We've talked about most of them. Be more active, quit tobacco, quit vaping, get healthy amounts of sleep, 7 to 9, feeling fine, manage your weight, control your cholesterol, manage your blood sugar, and manage your blood pressure. If you're doing all of these things, you're giving yourself the best possible chance to live a life that's long and full and healthy, and to avoid cardiovascular disease at a young age, because that's the goal. You want to make sure that you're living healthily through your life. And if you are at risk for any of these things, go to your doctor and find out what you can do. If you try all of these things and the numbers are still not, you need to get intervention. You need to get help. And if you don't have a family doctor, get one. The service that you guys are offering by checking all of those, the lipid panels, it's wonderful. It's maybe a really good avenue for people who are just not, who are doctor skittish. It's a thing. People don't want to see the doctor. So this is a great service. But I would recommend also making sure you get that physical, because your doctor can sit down and talk to you and give you information and pamphlets, and you can get on track, figure out where you need to go, how you need to get to optimum health. And we can all do that. There's little things that everyone can do to manage these issues to get to optimum health. And if you start right now, taking baby steps every day, in a month from now, you'll be better. In 2 months from now, you'll be even better. And 6 months from now, you may see all of your numbers drop into normal ranges. But that's what Heart Month is about, right? That's what we want to tell people. Now is the time. If you don't know it, you need to know it. Brad, I liked what you said earlier. You don't know what you don't know. It's so true. So let's find out, right? Let's do it together. Let's find out. Make an appointment with your doctor, with your primary care physician. Don't have one, find one. And let's find out what those numbers are and find out what your risks are.
Okay. Our final break is here, and you're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters. We are talking this morning with Jennifer McNeil from the American Heart Association. Local branch, is that correct?
Correct, Northeast Ohio. So it's
okay.
Stork, Portage, and like I said, into like Trumbull and Mahoning. It's a very big footprint. Akron, Canton, Wayne County. So
no Cleveland.
No, Cleveland is a separate entity, all on its own.
Okay. Okay. Our final segment of the show is here. We are on.
You mentioned, we talked about a number of metrics. Did you have anything else you wanted to mention about BMI, or did we cover everything you wanted to cover?
I think we did. BMI is losing weight. That's how you get your BMI to come down, is losing weight. And you want to focus on healthy ways of doing that, right? You don't starve yourself. You don't exercise too extreme. You take it one day at a time, making healthy lifestyle changes, things that are attainable and workable and doable. And you start small and work your way up, changing your diet slightly, moving more, walking more, take the dog for a walk, go up and down the stairs, those types of things. So losing weight is the BMI, is the one that'll bring that down.
So commenting on that, if I hope that we're all looking to be more heart healthy in 2024, how can I decide where to start? And maybe, is there just, you've mentioned a lot of numbers today that we need to keep an eye on. Is there a best place to start, just to not try to eat the elephant all at one time?
It's a lot. I know it's a lot of information to take in, and, thinking I have to watch all of these numbers it can be overwhelming. So I would say this, at the American Heart Association, we focus on healthy living for the whole body. So like I just said, baby steps, right? You start small, you do attainable things. Start by changing a little bit how you eat. You need to eat lots of fruits, lots of vegetables, lean proteins like fish and seafood. Make small changes, cut out the sugary stuff. If you're drinking, cut back the alcohol. If you're drinking sugary drinks, stop doing that. Drink a lot of water. and move more. And that can just be walking. You can just go for a walk around your block, one loop around your block the first day. Great, you did it. Maybe the next day you go a little bit further. Maybe the next day you go a little bit further. Take slow baby steps. You don't have to dive all in and try to change everything at once. You need to do it in a way that your body can adapt to and that your mind can grab onto. Because if you jump in and change everything in one day, you're never going to stick to it. You have to make it a lifestyle. Cardiovascular heart healthy living is a lifestyle, and you have to move into it slowly and do it smartly. At the end of it all, we want you eating healthy. We want you exercising at least 150 minutes per week. We want you to add moderate to high intensity, weightlifting as well, because we want you to lift those weights. Spend less time sitting, but you don't have to do it all at the same time. You can make a plan. You can sit down and plan it out and say, okay, in 1 month, I want to be walking 1 mile every day, or 1 mile every other day. So plan your work and work your plan, and do it at a pace that's comfortable for you. If you're already in a bad place, if your numbers are all bad, take a deep breath and do it one at a time, slowly, and dedicate yourself to the work. And that's all you can do. And do it at a pace that works for you, that works for your body and your lifestyle. But do it. You have to start somewhere. And you can't get it in your mind that, I'm already in this place and there's no way to fix it. Yes, there is. If you take anything away from the conversation that we've had today, it's that you can change it. You have the power to change it. Most cardiovascular disease is preventable. Let's prevent it. Let's start taking these steps to prevent it.
What's the American Heart Association's position on sugar replacement products like stevia, and oh my gosh, there's a whole bunch of them out there. And I started some time ago, actually quite a long time ago, I didn't drink very much, pop or beverages or whatever, but I did switch over to a diet product with stevia. And one of the interesting things was, and I don't eat pancakes very often or French toast, but there's a lot of sugar in the basic syrups, and I did try some of the sugar-free syrups, and they're really very good.
So the way that we look at it is really the lesser of two evils. We prefer that you cut out things like the syrups, and there are other things that they put into the sugar-free that we're going to have to see whether or not those things are good for you, right? It's going to be over time to decide whether or not those things are good for you. But if you're going to eat that product, if there's no way to stop you from having the pancakes and the syrup, then the lesser of two evils is the better choice. So products like stevia and sugar replacements, although the jury's still out, it's better than having a giant, pile of sugary syrup on your pancakes. I will say this, though. I'm going to throw this out there. What about if you had the pancake and instead you put a little bit of honey on it and some peanut butter and kind of made it a healthier pancake choice, right? So you have the pancake, which may or may not be good for you, depending on whether it's a whole grain pancake or a regular pancake. And instead of adding all that sugar, a little bit of sweetness, honey is a great sugar, replacement that can put a little bit of sweetness. And then let's throw some protein in there by throwing a little bit of peanut butter. I do that. It's delicious. You should try it.
Oh my gosh! Now they're talking about peanut butter being bad for you. Okay,
So
that's one of the latest things.
It is higher in fat. You've got the fat in it, but if you just use it in moderation, right?
Okay.
Let's talk about that a little bit too. Reading labels, making sure that you know what portion sizes are to help control what you're putting into your body. So if you read the back of the peanut butter label, I think it's maybe a tablespoon as a serving. That's not a lot of peanut butter.
Okay.
So we should be paying attention to serving sizes as well. But to get to overall good health,
but peanut butter does raise your glucose. Okay.
It can raise your glucose as well. So that's why it needs to be in moderation. It needs to be, I think I do like a dab of it and mix it in with the honey just for a little bit of flavor on a pancake. And I do the whole grain pancakes too.
Okay, I never thought of that.
Have you ever tried whole grain?
And then, well, I suppose, I don't eat
Yeah,
pancakes that often, but
right.
yeah, there are all huge varieties of them when you look at people in restaurants,
Right. The
going,
goal is to lower your risk for heart attack or stroke.
yeah,
So pick your battles. You don't have to cut everything out, but if you're eating red meat every day and
yeah,
if you're smoking and vaping, you are not doing yourself any good. If you're eating red meat once a week, right, it's going to be okay. If you're eating fish 3 days a week, red meat 1 day a week, chicken another day, that's how you do it. It's the variety. You don't have to cut everything out, but you have to focus your life a little more on the healthy side. And the way that you do that, healthy foods, diet and exercise, quit smoking, quit vaping, understanding what your numbers are.
Hmm.
I know it's a lot. It seems overwhelming, but like Brad, we talked about earlier, take those baby steps, right? One day at a time, plan your work that plan. And, the end goal is that you live a very long and healthy life.
Okay. Walking.
Yep.
Vigorous. Now I walk. Okay, this is a secret, but I'm going to tell you, I walk about 8,000 steps a day.
That's
But
awesome.
it's not fast motion. I'm just moving around the stores. Okay, stuff like that. So and that's kind of slow moving. Good, bad.
You're moving though. You're moving. You don't want to sit all day, right? If you work at a
Right.
job where you sit all day, you need to get up. So what I do is I take my phone, I set an alarm. Once an hour, I get up and I move because I don't want to sit all day. I want to at least walk around 2 to 3 minutes every hour to make sure I'm up, I'm moving, I'm circulating, I'm not just sitting here, because you can get trapped in your work and you forget to do it. Walking is one of the best forms of exercise. It is best if you get yourself outside when you can, when weather permits, like today is a perfect day, and you walk outside, right? And it's continuous motion and it's as vigorous as you can handle and still feel okay, right? And then you work your way up to even more vigorous exercise. So as you get better at it, you're going to increase your pace, you're going to go faster, and maybe you're going to go a little bit longer. But like anything else, you need to come into it slowly, because if you jump in and just, I'm going to walk 3 miles today, you're not going to do it the next day. You're going to be
Yeah.
sore, you're going to be tired, you're going to be done. So you
Okay.
need to take baby steps.
Okay. All right. I think we're pretty tight on time, aren't we, Brad? Can you share your website with our listeners and tell us what our listeners can find on there?
Hearth.org, very simple. And you can find a wealth of information on heart health, on heart disease, on stroke, on preventative measures. It's a wealth of knowledge. And like we said earlier, you can learn hands-only CPR on the CPR tab. There's a 90-second video that can teach you and your family how to save a life.
And what would you like our listeners to take away from the show today? And what are your final thoughts?
Final thoughts. Cardiovascular disease is largely preventable. Now is the time to take action to make those healthy changes. Number one, make an appointment with your doctor. If you don't have a doctor, find one. Get a physical, get your fasting blood sugar, get your cholesterol checked, your blood pressure, know your numbers so you know your risk. Remember that weight is not the only factor at play for cardiovascular disease. Family history plays a strong role too. You might be healthy, you might feel healthy, you might have high cholesterol and not even know it. You can prevent cardiovascular disease. Take the first step to do that. Go see your doctor. Get those numbers checked. Find out where you are.
Very interesting. Thank you to our guest, Jennifer McNeil from the American Heart Association. Very interesting today. Thank you. Thanks to Altman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.